Hello dear students. So today we are with a demonstration of the skull bone. You can see here, this is a skull bone. This is called as a skull cap, and this is the routine skull bone, and this is the only movable bone of the skull, that is called as a mandible. Now when we remove the skull cap from the skull bone, you can see here, we can see three fossas. This is the anterior cranial fossa in the anterior part. Then we have the posterior medial cranial fossa and the posterior cranial fossa. The posterior cranial fossa will have the second largest foramen of the human body, and this is called as the foramen magnum. Next, in the medial cranial fossa, we have the sphenoid bone, and in the anterior part, we get the ethmoid. So this is all. When we come to the skull cap, this is the frontal bone, this is the parietal bones, and this is the upper part of the occipital bone. In the skull, the bones are connected to each other with a joint, and this joint is a fibrous type, and this is called as a suture. Before 18 months, if we see, this bones will be the separate with a mesodermal cell lining, and this that time we will call it as a frontaline. Now between the frontal and the parietal bones, we get a suture called as a coronal suture. Between the parietals, we get the sagittal or parietal suture, and the back side we get the lambdoid suture, and this junctions, the meeting point is called as lambda, and here the junction between the coronal suture and sagittal suture is called as bregma. When we come to the lambdoid suture, it will be connection of three bones. Superior we have the parietal, posterior will be the occipital, and lateral we get the mastoid bone of the temporal. So that all makes the skull cap. Now in the cranial part, we have also one more bone. This is called as a temporal bone. Okay. With this, let's move on to the parts of the facial. We have the lacrimal bone here, lacrimal in the orbital cavity. It is formed also by frontal, sphenoid, zygomatic, maxilla, and this is the main bone, that is called as the lacrimal. Next, we have two nasal bones, right and left. Next, we have the maxilla. These are the maxillas too. This is a zygomatic bone. This is a zygomatic. Okay. Next, in the back side, we can see, this is the inferior view. Lots of foramens are there through which cranial nerve arteries passes. This is the vomer. It is right now not here. There will be the vomer bone, and this is the bone which forms the roof of the mouth, called as the palatine bone. So this is the palatine bone. Next, coming to the bone, this is the mandible bone. So this is all about the demonstration of a skull cap. This is skull cap, this is the skull bone, and this is the mandible bone. If you like the session, please press.